Hi, my name is Austin Atwell, and this is my healthcare reform project proposal for HCA 491A for Colorado Christian University. So, my project background is that healthcare reform aims to increase accessibility of healthcare, and this project aims to propose reform for the current government healthcare programs that will increase accessibility, as well as creating new government healthcare programs that will also increase accessibility for as many people as possible. Taylor Rainey at CloudMed is my mentor, and she'll look over my proposal, and in the end, she's the one who's going to tell me if the proposal is good, or she'll also go through and tell me what I could work on. So, what are the goals for this project? The main goal of this project is to create a healthcare reform proposal that will lead to increased accessibility to healthcare. There are three main factors of increased accessibility. That's the lowest possible cost, wider array of coverage, and health equity. So the lowest possible cost is getting down bare bones, what will people have to pay for this healthcare service out of pocket or with insurance? A wider array of coverage would cover things like long-term care and other types of things that aren't covered by Medicare and Medicaid at the moment. And health equity is just making sure that there's a fair healthcare system for all. At the moment, healthcare reform doesn't even cover all 50 states. Some states haven't accepted it, so it's hard to say that health equity is that there is health equity in America when we can't even all agree on what is a good healthcare policy. So the needs assessment. The financial needs are patients and organizations are currently dealing with large financial restraints due to COVID-19. This leads to increased costs. It leads to patients not being able to afford insurance. And there's a lot of other things. Healthcare has just gotten more and more expensive, especially with COVID, just because the hospitals are so packed and there's no room for anybody, no room to even build, just because of all of the restraints that COVID has put on us. Stakeholder needs. Stakeholders are anyone affected by healthcare reform. This includes patients, hospitals, long-term care facilities, and much more. So there are a lot of stakeholder needs to look into. But mostly those goals that I set, those are the three big things that we're going to look at to improve for all stakeholders. The nice thing about healthcare is stakeholders are really all looking for the same thing. Their hospitals are looking to get paid and patients are looking to get treated. And one thing in the middle of that is insurance. So if patients have their healthcare and it's paid for, the hospital still gets paid and the patients still get their treatment. So it's nice to have stakeholders that can work together on something like that. The spiritual, emotional, and philosophical needs or gaps. Patients aren't given access to spiritual services through current healthcare reform. I know I've been to a couple long-term care facilities where, even my grandma's, they do a Baptist and a Protestant church meeting, but they don't have church for all, so people have to actually pay to get rides to their church or find someone. So it'd be nice to have some kind of government or just some kind of thing that comes in with insurance to help those people get to and from their spiritual services. As well as emotional and philosophical, Medicaid at the moment does pay for therapy, but it doesn't always do it for all types of therapy, and it's very dependent on what a doctor says. Facility or equipment needs. We need a government group that creates equipment for hospitals, from PPE to even imaging machines. Hospitals would need to sign up, pay a yearly fee or something like that, and then they could either rent or they would just be allowed to use these machines and PPE from the government, so that we don't have the mass crisis that happened with COVID. That way we're always stocked up and there's a large stockpile of these kind of things for people, or at least the hospitals that need them. And then funding needs. So we would need a lot of funding if we're going to do healthcare reform, because honestly, it is going to cost more if we want to do more things. So this funding would be provided by taxes, medical groups, and patients. Like I was saying, if a hospital's paying yearly for that PPE thing, it would be almost like insurance, to where the government would be able to hold on to that money and use it for, to fund these things. So who are the stakeholders? There's many stakeholders in healthcare, but the big three are patients, healthcare organizations, and the government itself. Patients are the most important stakeholders in healthcare. They're the ones that we're trying to make sure that everyone is as healthy as possible. They receive care. Our goal is to make sure that they have better health outcomes. Patients require some form of insurance or government assistance to afford healthcare in America, though. You can go in for a checkup and it can be $5, it could be a $25 copay, or if you've got no insurance, it could be up to $600 just for a simple checkup, depending on where you live and what kind of doctor's office you're going to. Healthcare organizations. Healthcare organizations work with insurance companies to figure out the price for their services. One example is the cost of cancer care. Dr. Theriault asks, how much is life worth? Outside sources are constantly on top of hospitals saying that their care is too expensive and healthcare reform is one way to relieve them. I mean, everyone's always saying it's too expensive. I'm not feeling well, but I'm not going to go because it's too expensive. And if we can find some way to use healthcare reform to take that flack off of hospitals, it could reduce burnout. It could really make people feel better about what they're doing, because as a nurse or a doctor, if you're constantly, all you're hearing is, it's just too expensive what you do for me, it's really hard to get in your mind that you're doing good things, you're doing good deeds for people. And then the government. Many other countries live on government-run healthcare plans. These countries' healthcare systems also have many weaknesses, like long wait times and less competent medical staff. I'm not saying that's how it is all the time, but some of them do. The government currently uses taxes and other funding to support many Americans who cannot afford healthcare, and that's usually on an earnings basis. So if you make below, $20,000 a year, I think it was actually just bumped up to 25. But one version of healthcare reform would be to get rid of that low income amount and do it more on a, maybe your copay is higher if you make a little bit more money. We're going to look into that in the future. And then the government needs a new healthcare reform that can save money and increase Americans' health outcomes. We are not the healthiest country in the world, even though we have some of the best medical devices and some of the best medical studies that are going on right now, which is pretty crazy. So it would be great if we can just increase those health outcomes and we can at least get into the top 5 would be awesome. So what are the requirements for this project? This project requires all the previous resources used for healthcare reform, as well as all the information gathered since then. There's a lot of information that can be gathered in 10 years, but that will lead to better reform. So, there's a lot of information on health outcomes, how reform has worked, and the great thing, even though it's not great for the states that haven't adopted the old healthcare reform, the great thing is we have the data from the states that have adopted healthcare reform and the states that haven't, and those can be put against each other to show how reform helps people, as well as when we're talking about equity, we can see in some of the southern states how it has been unfair to some of the different groups of people, and how their health has been affected by it. So what tools are needed? For this project, my mentor and class will be the biggest tool in deciding if the project has met its goal. The baseline for the project is current healthcare reform. As a Christian, this project is meant to help all my brothers and sisters to live healthier lives. So my tools are pretty much, I'm trying to make new healthcare reform, and I'm going to go off what my professor as well as my mentor say, and if they think that I've got good ideas, I would just love to, create a plan that could actually be used. Literature review. So I've read a lot of literature so far just in this first 2 weeks. But these are 5 of the biggest ones that I really liked and thought that they gave a lot of good information. All the literature that I've used is published within the last 5 years. I think that's important because healthcare reform happened, 10 years ago. And in these last 5 years, there's been a lot of changes, especially with COVID. So recent information is very important. All of my information is relevant to my topic of healthcare accessibility in the United States. They're all peer-reviewed articles so far, with one .org source written by a peer-reviewed writer. So they still have, it's actually the Audrey Kearney. She's peer-reviewed and she's very good. And all information comes from other peer-reviewed sources. So I'm always looking at peer-reviewed content to make sure that I'm getting the best information possible. And all this information exists to show the needs of the current healthcare systems. So, biblical relevance. It's always important to talk about that. Blessed are the poor in spirit, for theirs is the kingdom of heaven. Blessed are those who mourn, for they will be comforted. Blessed are the meek, for they will inherit the earth. Blessed are those who hunger and thirst for righteousness, for they will be filled. Blessed are the merciful, for they will be shown mercy. Holy Bible, New International Version, 1973/2011, Matthew 5:3-7. So, what is this talking about? Matthew 5:3-7 are the words that Jesus spoke during the Sermon on the Mount. Jesus is speaking of the blessings we will receive depending on what we are going through. All of these blessings come from one another. So Jesus is asking all of us to bless one another and work towards a perfect world where we're all just helping each other through our acts. And we really need to use our acts thinking about God when we do acts of kindness, acts of goodwill, even evil acts. If we do evil acts, we need to know that we're doing those with God behind us. And, we just have to think about when we're doing bad things, that hurts Him. And here are my resources. Thank you so much for listening, and have a great day.